Welcome to this great webinar we have today on building a thriving practice with teledentistry. I'm Neil Kotari, the CEO of PracticeWeb. I'm really happy to invite you to this webinar where we're going to discuss how to boost appointments, provide more access to care, and have an efficient treatment process, especially during these trying times of COVID-19. We're really excited to bring our latest service to your attention, that being teledentistry. And there's so much potential, there's so much you can do with this new treatment approach that we're really excited of how it can help your practice thrive. So with that said, I wanted to get into a disclaimer quickly that lets you know that this webinar is just for informational purposes and it's not to be considered legal advice. We will be mentioning certain laws that might apply to teledentistry, but we're not providing legal advice. And we're also going to cover some billing and coding observations, but there's obviously no guarantee of reimbursement and plans do vary. And as always, you should code the actual work that you do. With that disclaimer said, I do want to introduce myself. I'm Neil Kotari, the CEO of PracticeWeb, and I'm really happy to be joining you and helping present this important topic to your practice. With PracticeWeb, I do want to point out that we do have an all-in-one practice management solution. So everything from the beginning of your workflow, whether it's starting with online scheduling to doing your patient forms before an appointment, and then sending out your text and email reminders. Also, we have text and email marketing to really get more patients in the door. And then today we're going to focus on teledentistry, which is our latest service, as I mentioned. And then beyond teledentistry, during an appointment, you have the e-prescribing service that we offer. After an appointment, you want to make sure that happy patients are able to share their excitement to future potential patients on your social media sites. So we have an online review service. When it gets to the billing process, we have e-claims and insurance verification and a lot of other things, including attachments for your e-claims that are integrated. And then if you're collecting payment from patients, we have credit card and pay by text to really streamline that process. And then finally, we have smart caller ID. So whenever your patients call in, you can get some very specific actionable data to make each of those calls productive and revenue boosting. And then finally, we have a specialist referral system that's great if you need to refer out a patient to a specialist or take in those referrals as well. So that's PracticeWeb all-in-one solution. Beyond just practice management, we provide all of these smart tools. And like I said, today we're going to focus on teledentistry. So with teledentistry, it's been just an incredible last couple of years because the trend has really been increasing and the interest level in how to incorporate this new model into your practice. So from the dentist side and the patient side, there's been an increased level of interest and usage of teledentistry. And this was not just because of last year in 2020, what we saw with COVID-19. It's been on the rise in the last 5 years. You can see here from the Google trends that we looked at, you can see a steady upward trend. And you know, it certainly spiked last year, but it hasn't really backed down. And this is going to be a new normal that we all have to consider adding to our options for the patients that we treat. This is the new normal. There was a survey done before COVID-19 in 2019 by Dentavox, and they found that 78% of patients want this treatment option of teledentistry or this consultation option. And the gap there is the fact that only 12% of providers are actually offering that. So this is a great opportunity to provide something that's in high demand but low supply, and you rarely find this kind of gap. And when you do, you certainly want to be that dentist, be that dental office that provides what patients are looking for that no one else is offering. So there was a survey done by the Health Policy Institute with the American Dental Association last year in July to look at by specialty actually what is everyone doing when it comes to teledentistry, who's using it, who's not. And so they found, you know, this kind of variation between specialties. that you can see in this graph, pediatric dentistry was very much involved in teledentistry, whereas general practitioners not so much. And so we can just see this state of affairs last July. And then when you drill down on it, you see that there was a spike in April of 2020 when offices were shutting down or just starting to come back online after a massive quarantine. And now, and then later in July, it actually went down to about 12%, which is what I mentioned earlier, that only 12% of providers seem to be offering this option to their patients for teledentistry. So what is teledentistry? Teledentistry is when a dental provider conducts a virtual consult via phone, text, email, or video. It could be any of those methods to diagnose issues. You can offer care, advice, or determine if an in-person visit is necessary. And that's really the three main areas where you're seeing this used. Now, within teledentistry, there are two different types that we want you to be aware of. One is called synchronous. You'll hear that term when you get into coding for teledentistry, etc. Synchronous means real-time interaction with the patient, whether that's through video or phone call. Usually it's going to be through video to really be effective, but it has to be a real-time interaction, and that is CDT code D9995. We'll refer back to that later when we get into billing, but that's synchronous, and that's really what PracticeWeb is offering for your office, where you can use this type of synchronous video technology to do your teleconsults. Now, asynchronous is another option, and that's sort of the traditional or older way of doing things. It's not a real-time interaction. It still has its use, but the patient might communicate over secure email, let's say, and send over some photos or x-rays, and that's later reviewed by the dentist. It's not real time. This is also referred to as store and forward, and this is CDT code D9996. So these are the two types to be aware of. We are going to be focusing on synchronous real-time teledentistry. Now, what are the benefits of teledentistry? So one, it's more convenient and efficient for, I would say, both the dentist and the patient. You might think of the patient convenience, but it's really also convenient for the dentist because, you know, there's less front office time that you're dedicating to getting that patient in the office and back to the back office and going through that whole process with them. You're just able to log in, log out for the specified time to do the teleconsult. But obviously there's patient convenience, and that comes from the fact that there's no commute for the patient, no waiting rooms, and none of that frustration associated with those two aspects. It also prevents an in-person visit to the dental office unless necessary. So you might be able to do a triage or problem evaluation and then determine whether someone needs to come in. At the same time, you can do a smile consultation. So we'll get into these different applications of teledentistry, but it does prevent an in-person visit unless it's necessary. It is an alternate option for patients who are concerned about health and safety, or they're just scared to come into the dentist. And that gets into this idea that you're really expanding your patient base to those who may not come in because of these, either they have a time concern or it's a safety thing, especially with COVID-19, or they're just scared to come in. They want to make sure they have to come in. And that's where you can use a teleconsult to determine that. And lastly, but very importantly, insurance reimbursement has really spiked up since the advent of COVID-19. Some of the limitations that were there on what you could bill and how much you could bill have been relaxed or removed. So this is really a great time to enter into this space, especially if you're doing insurance, accepting insurance in your office. This is a good time to get in and try to get reimbursed for teleconsults. Now, there has been this idea that perhaps teledentistry is not as accurate or as reliable as an in-person exam, and that's really just not the case. And it's been borne out by several studies done in the last 10 years. And so this is one study where it was looking at in-person versus what they called virtual dental exams or teledentistry. And they took 29 patients and they had in-person and virtual exams by 3 dentists for a total of 162 virtual exams. So the dentist had to determine whether a patient was healthy enough to be treated on site where they were by allied dental personnel, or whether they had to come in to be seen by a dentist. That was the kind of a purpose or objective of the exam. And they did this determination both virtually and then in person to compare the results and the decisions. So the conclusion arrived in this study was that the decisions a dentist makes based on a virtual exam are unlikely to differ from that of an in-person exam, and that a virtual exam is a strong substitute for an in-person exam. And that's just really a tremendous finding. There's some more information here just showing that dentist A, B, and C, let's say, the virtual exam and direct exam, the decision making did not differ much at all. Obviously, between dentists, you'll see different decisions made, but the same dentist, whether they're seeing the patient virtually or in person, it didn't really change their decision on whether this patient was healthy enough to be seen in office or on site versus had to come in office. So really, a really good kind of conclusion when it comes to the decision making, and that teledentistry is a strong substitute. Another study was done looking at the accuracy of teledentistry for diagnosing dental pathology using direct exams as a gold standard. So they really took that in-person exam as a gold standard and then just said, how does the teledentistry stack up with that? So in this exam, or this study, they looked at 237 nursing home residents. I think they were in France and Germany, and they had oral dental complaints, and they enrolled in this study. The dentist did look at video recording. So this was asynchronous. So which is asynchronous is even sometimes tougher, because you can't, as a dentist, you can't tell the patient what to show you and kind of move around the camera and all these things. And so this is even tougher than what the method that we are offering today, which through the synchronous video-based teledentistry. But even with that video recording approach, so dentists use those recordings of patients' oral cavities to check for dental pathologies and assess their chewing ability and the rehab status of dental prosthesis. They also checked for inflammation. And so within 7 days, the same patients were seen again by the same dentist face-to-face. And then there was a comparison between the diagnosis in both of these scenarios, whether it's teledentistry versus in-person. So the results were that teledentistry had excellent sensitivity and specificity for diagnosing dental pathologies when compared to the face-to-face exams. And that goes the same for when they were assessing the chewing ability by these nursing home residents. And this was a quote from that study, that teledentistry has excellent accuracy for diagnosing dental pathologies and good accuracy for assessing the rehab of dental prosthesis and chewing ability among this group that they were looking at, which were older adults in nursing homes. So now, looking at the fact that it's reliable, it's a great method, it's a lot of benefits for your practice and your patients, where can you actually implement teledentistry? So a hint is, it's not just for problem evals, and that's what a lot of people think. It's just for triage or to assess a problem and then get them to come in if they need to do a further exam and treatment. So that is one very important application of teledentistry, where you can triage your patients, whether they're new or existing. However, it's great, really excellent for follow-up care. So you can have follow-up care after a procedure done in the office, or it could even be follow-up care to an initial teledentistry session, where you're trying to see how the patient is doing after the directions you provided. And so follow-up care is a great application. Another one would be hygiene assessments. You can really assess how the patient's hygiene is and how they're doing there. And then you have a great scenario of smile consult. So excellent use of teledentistry, where you can do a smile consult, and whether it's for cosmetic dentistry or for orthodontic treatment, you can do an initial consult via teledentistry. Great application. Then you have treatment planning. So you can discuss treatment with patients via teledentistry and go over what you think needs to be done and hash that out without having them come back in the office for that. Then once they've agreed to that treatment, they understand, then they can come in and get that taken care of in office. Another great use is prescribing. So you can figure out if a patient has certain pain that you can treat with medication, or any other scenarios. So prescribing is a great way to use teledentistry. Finally, specialist referrals. This is a great area because you can have a discussion with your patient. Maybe you're the kind of primary dental provider for them. You can have a discussion, figure out if they need to get referred to a specialist. And once you do that, you can even have a combined call with your specialist to coordinate that care. And if you're the specialist, you can get introduced to that patient and do all this stuff over teledentistry. So it's great for referrals and having a great coordination of care. Now, those are some excellent scenarios, a lot of application of this technology in your practice. Now, the question is, do you want to do this the hard way or the easy way? Obviously, no one wants to do it the hard way, but that seems to be what a lot of folks are doing. So I'm going to go through the hard way and then explain the easy way that we're offering to your practice. So the hard way is, initial contact. It could be over phone. They're calling in the office. Then someone in your front office is scheduling that patient. When it comes to doing the paperwork, the patient forms, it could be done by paper, and then you're scanning in paper after the forms are filled out. And then you have the aspect of confirming the appointment. Again, front office person could be using up their valuable time to make those phone calls and confirm this teleconsult that you're setting up. And then when we get to the actual appointment, that's where you might be using a phone approach, email, which we talked about, which is asynchronous and kind of not real time, or maybe some sort of messaging app. So it's like a Skype or a Zoom or something else. So that is not the ideal way, and I'll get into why in a bit, but that's part of the hard way. Then when it comes to documentation, you might be documenting it in varied places, maybe not in your practice management software, and you don't really have, in many cases, a recording of your interaction to go back to. If that was a video interaction, for example, you don't have that recording to refer if you need to. And then when it gets to care coordination, you're really trying to get the right steps for that patient, whether they need to go to a specialist or you need to write up a paper prescription, get that over to them. It's just a very tedious process if it's not streamlined. And then when it gets to the all-important billing phase, then again, you're doing things perhaps through paper, billing statements, or you're having the patient call in and try to get payment that way. So this is a very piecemealed, segmented, unintegrated approach, and it is really the hard way. And this is why, a big reason why a lot of offices don't take that step to do teledentistry, because they have this concern about piecemealing together a process. Now, when it comes to PracticeWeb, we're trying to make it easy for your office. So with the initial contact, that again could be through phone, or it could be through texting, emailing, through your website, social media. We have a great patient portal where a patient can message your office to come in, but there's so many different ways that we offer for that initial contact. Then when we get to the scheduling phase, yes, they can call in or contact a staff member to get on the appointment schedule, but the other options we offer include online scheduling, which is a great convenience, which I'll go into in a bit, or you can have this inbound digital referrals, because we have a specialist referral service within PracticeWeb. So scheduling is made easy. When we get to patient forms, that can be done through mobile forms, or if you're doing the online scheduling, there's a forms section of that where the patient can just fill out the forms right after they book the appointment online. So a lot of streamlining when it comes to patient forms that's digital, paperless, and headache-free. And it goes all right into your PracticeWeb software. Now, when it comes to confirming the appointment, yes, the staff member can making some calls. However, we offer automated texting, automated emails to confirm appointments. If patients reply to that, they're going to be able to automatically update that appointment on your schedule in PracticeWeb. So it automatically will change that status to confirmed if they reply to that text or that email. So it's a great part of this solution, all part of PracticeWeb. Now, when we get to the central part of this, which is the appointment, that's where we're going to rely on this pwTeledentist service. And that's live audio and video through HIPAA compliant dentist and patient portals. So you can log in through dentist portal, patient portal. You can even log in through your PracticeWeb software if you don't want to get to the dentist portal and interact with your patients. So integrated, not a separate solution like a Zoom or a Skype or a Google chat type of thing or Google Meet. This is all within PracticeWeb. When we get to documentation, the great thing is that this video is going to be recorded and it's going to be in the chart for your reference at any time. And you can have all your notes in PracticeWeb in the chart. And we'll even get into, in this webinar, what type of notes should you be taking to document a teleconsult interaction. And then when it gets to care coordination, we have e-prescribing, as I mentioned at the very beginning of the webinar. We have e-prescribing. We have outbound referrals that you can do through our specialist referral service. There's automated follow-up that can occur, whether it's through automated recalls, et cetera. So there's a lot of automation there in care coordination. And then when we get to billing, you can do the two approaches that I mentioned earlier, or you can do e-billing or pay by text. And that's really a great complementary service for teledentistry. Now, when you're choosing teledentistry software, you want to make sure it's HIPAA compliant, it's integrated with your practice management software, there's an archiving or recording capability, the technology is spot on, there's clear kind of video interaction, it's mobile friendly because the dentist might be wanting to do this from a different location, not in the office, maybe they're from their home or somewhere else. So you want to make it mobile friendly both for the dentist and of course for the patient, and allow the patient to log in from their phone. Then the price, obviously you have all this great technology, but you don't want to pay an arm and have an arm and leg for that. So the price is important. Now let's get drilled down further into the process. So initial contact, as I mentioned, there are all these options here for the patient to reach out to you and to say, hey, I want to be seen for my problem or my smile consult, and let's get that on your schedule and so I can see the doctor. Now, when it gets to scheduling, I mentioned online scheduling. So we have a great online scheduling option. If you look at the top here, there's a book now button that you can place on your website, on your social media sites, to make that very convenient. So anyone coming to your site, whether it's new or existing patients, they can click on that and jump right over to this online appointment book. And in there, under the appointment types, that's where you would put all the different virtual appointments that you offer, whether it's emergency exams or smile consults or hygiene assessments, etc. So they can pick from that list, pick their provider, choose the date, and then the times. And these times are actually available when they're making this appointment. It's looking to your PracticeWeb schedule and figuring out what's available. And that's just incredible real-time process there to make sure that what they're booking is actually available, and it's not a appointment requesting system. It's not a requesting system. They're actually booking appointments on your PracticeWeb schedule through this service. Now, when it gets to the scheduling it manually, so let's say someone calls in or emails you or texts you, I want to be seen, and it's a teleconsult, then you would want to set up that appointment in PracticeWeb, and under the field called unscheduled status, you'll simply select video call to designate this as a video call. And once you click OK, that's really going to send them a message, which I'll show you in a bit, confirming that you have a video call now set up with our office. And if you want to even start the video call from this screen, you can. There's a video call button in the bottom right where you can actually start the call right from here within PracticeWeb. So patient forms is another important but sometimes tedious process. We have mobile forms and online scheduling forms. When we're talking about forms, one thing to get clear is that it is highly recommended to have specific consent when it comes to teledentistry. The ADA has published some sample language. We are going to have a sample form in our PracticeWeb next version release, but that will be available for you. But even if you don't want to use that, you should have some sort of teledentistry consent form, and this is a good place to start if you want to go off of what the ADA is recommending. So they have this interim guidance that they issued late last year, and that's still very useful. And the site is there at the bottom. So if you're using online scheduling, let's talk about now. We know we need a teledentistry consult or a consent form. There might be other forms you want them to fill out. Now, how do they actually fill out those forms before their teleconsult? So if you're using our online scheduling service, then you can have those forms as part of this process. So every appointment type you have in the online scheduling service can have different forms associated with that. So if you want teleconsults to have specific forms, like a consent for teledentistry, you can make sure that appears right after they book the appointment. They're going to see the next thing is fill out your forms, and you get this all filled out and submit it. It's going to go right into PracticeWeb. So paperless, digital, no manual entry process. Now, with our mobile forms, if you're not doing the online scheduling with mobile forms, it's another great option. You can have a teledentistry informed consent, for example, or even send multiple forms, and the patient can fill it out on their mobile device. It's very friendly on the mobile device, and it's designed for that. So this is a great mobile form approach, and that again will go into PracticeWeb, and you will not have to scan anything in or do anything manually. Now that's the forms aspect. Now what about confirming appointments? So I did mention that as soon as you schedule a video call in PracticeWeb, you will get this text that's triggered and sent out to the patient, and that will tell the patient that you have this video call scheduled with our office, and here's the date and time, and please, you can confirm now and just let us know you got this. And here are the instructions to join the video calls. They simply have to log in to their patient portal, and I'm going to go into that in a bit as well. So this is one aspect of the texting. But another aspect is going to be that we have automated confirmations and reminders that also will be sent to the patient if, let's say, that appointment, that teleconsult was scheduled a few days out. So they'll get that confirmation text additional and also a reminder. So they're not going to forget because of all the reminders they're getting. Now, when it gets to the appointment, that this is the golden part of this, and that's what we really want to share with you. So pwTeledentist has that live audio and video. And how does that work? So on the dentist side, you can start that video session when you're ready to go. When it's 2 o'clock on Friday, you have that teleconsult with your patient. One option is to go into PracticeWeb, pull up that appointment, and click on that video call button that's going to be in the bottom right. Another option is if you want to join the video session and start that session as a dentist from your mobile device, you can do that. And so all you have to do is simply log into your dentist portal, find the patient, click on video session, and you're good to go. You click there and it's all initiated. Now, once you do that, you'll see this type of view where you will see the patient. It'll be a bigger screen for the patient or bigger video feed, and then you'll be at the top of that, and you'll now have to have that great interaction with your patient. You can do this, like I said, from your mobile device. If you're doing it from a computer, obviously it's ideal to have a webcam. It's not necessary, but you should have a webcam so that the patient can see you. From the patient side, it's very easy. They just log into their patient portal, click on video session, and they're now part of the teleconsult. So when the time comes for that appointment, they simply have to log in and click on video session. Now, once you've logged in, everyone's good to go. You're ready to do your HIPAA compliant teledentistry appointment for whether it's a problem exam, follow-up care, smile consult, or anything else that we referred to earlier. And you can see from these graphics that there's so many applications. So it's, like I said, smile consults or problem evaluations, triaging, hygiene assessments, prescribing medication, treatment planning, all the specialist referral coordination, all of that can be done through your video session that you've initiated from PracticeWeb, whether it's the PracticeWeb software, dentist portal, or patient portal. Now we've done the appointment and we want to go into documentation. So like I said, there's a process where your video session, you had a great appointment, you went through that whole consult. Now later on, if you would need to refer back to that, let's say it was a smile consult, you want to go back and look at what the patient was showing you, or if it's a problem evaluation, you want to go back to that as you're doing your notes, then this is a great aspect that the video of your session with the patient is recorded automatically. So let me show you how to do that. You can go, once the session is completed, it will show up in your chart as a entry there, as a ComLog entry. It'll say the video session, when it was started and ended, and then you have a link that you can click to immediately access that recording. So this is also available in the account module. It'll show up in the communications log there. And like I said, you can just right click on that entry and click on this web link, and that'll take you right to your recording to watch that again, watch it back. Great archiving option, and it's also, you know, obviously good for documentation. It's right there. So speaking of documentation, how should you write your procedure notes? There are, you know, a lot of important things to remember here, but once you get the hang of it, it's super easy. And the great thing in PracticeWeb is you can set up default notes for a teledentistry procedure, like that code we mentioned, D99995. You can set up that default note. So every time you have that procedure, it will make sure that it prompts you to put in all the information I'm about to go over. So one thing you should mention in your note is what was the originating site, and that just simply means the patient's location, wherever the patient is. So it could be patient home address, or if you're doing a type of teledentistry where you have satellite offices where there is no dentist, but maybe you have hygienists or dental other folks that are authorized to provide limited care. You can have a satellite office where the patient is set up, and then the dentist is in another office. So in that situation, the originating site would be your satellite office. But in most cases, the patient is going to be at home, so you can just put patient home address there in the note. The distance site is the exact opposite. Where's the dental provider located? So that could be the provider's home or the office address if they're doing it from the office. The presenter is going to be the patient. If it's a satellite office, it might be another dental provider that is assisting in this video session. And then obviously the provider needs to be documented. So that's simply your name and signature. The method is important to document. How are you doing this teledentistry session? And as I mentioned, if you're using pwTeledentist, you are doing synchronous or live real-time interaction. So that's really what you want to list there in the procedure note and mention what you're using there. But if you're doing this interaction where it's asynchronous, you're getting documents and images and x-rays from your patient and then looking at it at a later time, you want to put it that it's an asynchronous interaction. Obviously, as with any note, you want to put in the chief complaint, symptoms, and treatment plan. And so that's just part of your normal process. And then lastly, any care coordination and next steps for the patient, that's important to document. So are they going to come in the office to see you? Are they simply going to follow your instructions and then get follow-up care, which again can be done through teledentistry? Or are you referring out to a specialist? Was there any prescribing involved? So document all of those things. Now, care coordination, as I just alluded to, is important. So whether that's what do we need to get some medication to the patient? Can we use e-prescribing for that through PracticeWeb? Is there an outbound referral I need to make to a specialist? We have a specialist referral system called MedCohere, which is great. Another aspect would be ASAP list. So if they need to get in quickly, you can get them on the schedule, but then put them on the ASAP list as well, so that if there's an earlier opening, you can get them in. There's automated follow-up that can occur. So with our texting system, you have automated recall reminders. You can have other sorts of messages going out. So there is that additional nice step involved with texting and emailing. So that's a care coordination piece. That's part of PracticeWeb. And then when you get to billing, what I'm going to focus on today is pay by text, but we have e-billing as well. And we also have merchant card processing. So if a patient called in after the appointment and to pay, you can have them provide their credit card information, and you can process all of that right through the payment screen in PracticeWeb if you're using either PayConnect or XCharge, and as well as ProPay. There's 3 options to do credit card processing right within the payment screen in PracticeWeb. But let's focus on pay by text, because that's a really amazing feature. With pay by text, like we were talking about with teledentistry, you similarly hear a lot of patients want it to be very easy to make payments. You know, this is the age of Apple Pay and doing all your payments through mobile devices and PayPal and all this stuff. So patients are used to that now, and they want to have that same experience with their dentist. So at least 35% of patients want to pay by SMS or text, and very few providers are actually providing that right now. We do provide this service to you and through PracticeWeb. It doesn't cost you any monthly fees or any service fees. It's just the transaction fee that would normally be incurred when you're doing any sort of credit card processing. So from the payment screen, you can send out, click on the pay by text button, send out an amount to get paid for that treatment, and the patient will see a text message. They'll click the link. They don't have to log in. They don't have to create any sort of account. It's a very quick few steps. They see the amount, they put in their credit card details, they confirm, and they pay. And once they make the payment, that goes right into your bank account for the practice, and it will show up in your account module as an entry. So that's another great thing, is you don't have to manually then enter that back into the account module. It will automatically show that a payment was made via pay by text. Now, that's payment from the patient side. What about insurance billing? So insurance billing is, you want to be very, very good at picking the right codes, and the documentation is obviously good to back that up. But let's talk about the codes. So teledentistry, there are these two codes, D9995 for the type that we are focusing on in this webinar, which is synchronous, real-time live interaction, video-based in this case. But if you're doing asynchronous, where you're getting messages from the patient, looking at it later, and then providing care that way, that's going to be D9996 for asynchronous. Now, those are the teledentistry codes. You also want to pair that up with evaluation and case management codes, the actual procedure codes that apply. So the most effective or highest reimbursement, or most often reimbursement, is with the D0140 code. That's a limited oral eval, problem focus. So this is your triaging and your problem evaluations. That's going to be your best bet if that's applicable. Then beyond that, you have D0170. So if you're doing a re-evaluation, like a follow-up care, then you can use that code in the right circumstance. Beyond that, you have D0171. That's a post-op visit. So post-op care, as I was talking about, can be done through teledentistry in the right circumstance, and that can be billed out in conjunction with the teledentistry codes. And then lastly, you have dental case management. So that could be part of like the treatment planning type of consultation, and that could be reimbursable as well. So the ADA has looked into all of this, and you see that citation at the bottom in terms of where there's some more advice on this, and so that's going to be a great resource to go back to and to look at. And I'm going to refer to this more in a minute. So with the place of service, that's another key part. Not just the codes, but the place of service has to be properly indicated. And so in PracticeWeb, when you go to the claim screen, there is a section at the bottom left of that claim screen where you can have select a different place of service. You click on that drop down, go down to telehealth, make sure that's selected. And that's going to be, as far as we have looked into it, it's 02 in the claim for the live teledentistry interactions, and it's called telehealth. So make sure you mark that place of service. Now, when we get into state laws and payer reimbursement, as we alluded to at the beginning, this can vary by state. There is one good resource here that you can refer to get acquainted with your state in particular. This is a resource assembled and managed by the Center for Connected Health Policy, and the website for them is there at the bottom. And this is great. You can go in and see what is California doing, what's Texas doing, what's New York doing, what's all these states doing for telehealth reimbursement, and what kind of state policies are in place. But when it gets to the plans, it can get even more various. It can vary more. And so the ADA has provided a nice resource as a good starting point. If you go to that same interim guidance I've been referring to again and again, they have a list of plans that they surveyed to ask them, what do you guys do when a dentist is going to be billing you for teledentistry? What codes are you reimbursing? In what circumstances does it apply? So great starting point. Obviously, talk to your insurance plans, get the real information from them. You might have different plans that are not listed in this resource from the ADA. So just talk to your plans and just get a good grip on what the best approach is with the billing. Now, that kind of covers the whole process. So from the scheduling, initial contact point of view to the actual billing of the teledentistry session. So we do have some special introductory pricing for teledentistry. This does expire at the end of this month. If you're watching this after February, then just contact us. We might have a great price for you. And we're always trying to make it easy for you to take advantage of these excellent services. So when it comes to pwTeledentist, we are offering this great introductory price of $49 a month. It's an incredible deal. If you go out and look around, this is just very, very competitive, and it's fully integrated in PracticeWeb, as we went over. So you'll save about $600 a year with this special offer. If you don't have our texting service, you can see from this webinar that texting does play a big role in that interaction with the patient to make sure they're aware of the appointment, they're getting reminders, confirmations, and that's all kind of coming back into your system and to your schedule. Then you want to get this texting, and texting is not limited to teledentistry. It's a huge benefit to your practice for all of your appointments with the automation of confirmations and reminders, automated recall reminders. There's a lot of marketing that you can do and send out dental specials to all your patients via text. Text is the best way to reach your patients in 2021. And you also have a lot of on-demand, in all of your appointment lists in PracticeWeb, whether it's a recall list, confirmation list, ASAP list, unscheduled list, that all has texting integrated. And finally, you can do two-way texting with your patients. So any questions they have, anything they want to talk to you about, they can just text you. You'll get that right in PracticeWeb. You can text them back. Or if you want to just send them a quick text about anything, make sure you bring this or that, or we need to get updated insurance information from you, you can text them right from within PracticeWeb. So a hugely beneficial service there. And then online scheduling, which I previewed for you in this webinar. We have another dedicated webinar just on online scheduling that you should check out on our YouTube page. But this is a great service to incorporate with teledentistry, and that's only $99 a month. And you're saving $1,000 with all of these special prices we have on each of these things. And so that being said, there's a package deal. So we're going to provide a package deal. If you need all three of these services, it's only $187 a month. And that's regular price for all these things would be $450. And so you're saving around $3,000 a year with this package deal that you can take advantage of. And we will provide, we do have forms for this on our website. So if you go to our website under the pricing page, there's a section called Smart Tools, and there's a form right at the top. You can sign up from there. You can contact us. So reach out to our sales team. You can call us at 800-845-9379, option 1, or sales@practice-web.com. And that's another great way to get in touch. Also, I didn't mention just a moment ago, but there is a way to get that sign-up form right from within PracticeWeb. So if you go to e-services at the top toolbar, there's going to be all these options there for our different smart tools. You click on those and you can just go right to our sign-up form. And so yeah, there's many ways to get going on this that shouldn't stop you because we make it easy. And we're really excited to get this teledentistry going for your practice. Like I said, it's going to help you boost appointments, provide more access to care, have a really efficient treatment process. And it's in 2021 and beyond, this is going to be key to differentiate yourself from other dental practices and really boost your appointments and succeed. So that being said, I'm really happy to be able to join you on this webinar. I hope you found it informative and educational, and we're really excited to talk to you about how to implement teledentistry in your practice, and as always, help you thrive.